We are live with another Ovadia Heart Health telemedicine live stream. Hi, everyone, and welcome to the conversation. I'm Chris Cornell, health coach and host of the iFix Hearts YouTube channel live streams. And today, I'm excited to introduce someone whose work is making a real impact in the world of metabolic health. Shannon Davis is a registered dietitian with nearly 2 decades of clinical experience, spanning organ transplant, nephrology, bariatrics, and even pharmaceutical sales. But it was her personal struggle with fertility and metabolic health that led her down a path of transformation, both for herself and for how she now helps her clients. Today, Shannon sits on the founding board of the relatively new American Diabetes Society, and she coaches patients through Ona Health alongside endocrinologist Dr. Mariella Glant. Her mission is to cut through the confusion and help people overcome insulin resistance and improve their metabolic health, not with more meds or misinformation, but with tools that actually work. So Shannon, thanks so much for being here. I've been really looking forward to this conversation. And before we get started, I just have to get a little bit of the legal stuff out of the way. And that's, we're going to just let people know that anything that we discuss here today is provided for educational, informational purposes only, not a substitute for professional advice or treatment. And you are advised to seek care of a qualified doctor or medical professional when undertaking any changes to nutrition, diet, or fitness, including anything that we talk about today. If you'd like any information regarding a medical consult with Ovadia Heart Health, please email us at team@ifixhearts.com, or you can get in touch with us and make an appointment with one of our metabolic health consultants at ifixhearts.com/talk. And with that, I will clear the screen, and I would love it if, Shannon, you would tell us a little bit about how you got to the point where you needed to address your metabolic health, what some of the keys were that got you started on this incredible transformation and journey that's now helping so many people.
Awesome. Well, first and foremost, thank y'all so much for having me. I love sharing my story, motivating others. And I mean, I don't want to sound terrible when I say this, but all dietitians are not the same. Unfortunately, we're all conventionally taught in school the dogma that you've heard preached to you for, 20, 30 plus years, that we need to eat every 2 to 3 hours, that we need to eat lean, low fat, fat-free dairies, lots of fruits and vegetables, lots of whole grains, and that calorie in versus calorie out is the way to go. And so, as you and I both know, Chris, that's not the answer. If it was, we wouldn't have 93% of our population suffering from insulin resistance. We have the best meds available. We have the best doctors available. We have the best tests available. And our nation continues to do this on the path to sickness and type 2 diabetes and obesity. I have been a dietitian for 19 years. And unfortunately, the majority of those years, I did preach that. I did sit across from people and talk about it every day. And so I humbly apologize to each and every one of you who sat across from me and I was unable to fully heal. I say that keeping patients alive is one thing, but helping them thrive is another. And that's my passion. And that's what I do today. But I sat across from people, and while I know I helped people, I definitely did. Nobody left and came back without their bag of medications. Nobody, left my dialysis clinic and to not return unless they got an organ transplant or unfortunately passed away. In the hospital setting, the few minutes that I got to spend with people talking about how to count carbohydrates or how to stay away from salt or how please don't add butter, use margarine. People didn't hear what I had to say. And people, no one wants to be sick. I mean, think about it. No one wants to weigh 400 pounds and be on 19 meds. And most people know that donuts and cookies and milkshake coffees aren't what we need to be eating for breakfast, but we do it every day. We see these people every day. even myself, somebody that I considered healthy. I practice what I preached. I exercise every day to a default that's probably a little too much exercise. I ate fat free. I didn't have a stick of butter in my house for 15 years. I ate every 2 to 3 hours, to the point where my colleagues would be, they kind of looked at it as a joke, like, oh my God, Shannon's eating again. Look at all that fruit. Look at all that healthy food. And yet my labs looked like trash. I wanted to have a baby, so much so that I was willing to go to whatever depth that meant. And that was a year of IVF. And throughout that whole journey with the best reproductive endocrinologist in the city, I still, unfortunately, did not get pregnant. But really what opened my eyes were the conversations that were not being held. Never once did anybody have a conversation with me about, let's talk about really what you're eating. Let's talk about the chemicals. Let's talk about the fat. Let's talk about, getting rid of processed food. That wasn't discussed. Now, I hope it was because I'm a dietitian and they just assumed that I know that, but I didn't know that. And so it really took me down the rabbit hole, like, okay, I'm healthy and I can't get pregnant, but I'm not broken. There's nothing wrong with me. So what's going on? And I picked up Lily Nichols' book called Real Food for Pregnancy. And man, I've never looked back. That sent me down the journey to now. Dr. Ben Bickman is one of my biggest mentors, and I consider him a friend. Dr. Ken Berry, the same. Dr. Robert Lustig, I've not had the pleasure to meet, but hopefully one day. Dr. Jason Fung, Dr. Elijah Rouge, and Dr. Ovadia, like people that are saying things that just make far too much sense. Chris?
So tell me, you mentioned Dr. Lily Nichols' book. What did you find in there? What were a couple of the biggest revelations that you realized you were doing it wrong? Like, what were those things? And what are some of the things that mainstream medicine teaches that you think cause the greatest harm?
Okay. First and foremost, that we don't need to eat every 2 to 3 hours. Y'all, we're not going to starve. And our metabolism isn't going to slow down if we're not constantly fed at fuel. I mean, I have this picture in my mind that we used to talk about, or I used to think about, okay, it's like a smoldering fire. You got to constantly put wood on that fire to keep it blazing. Well, no, we wouldn't be alive today if that was the case. Our ancestors didn't keep that fire smoldering. They burned their own love handles. So one, that we need to eat every 2 to 3 hours. Two, that fat is our friend, right? That the more fat we eat, the more metabolically healthy we get. Not eating fat doesn't equal fat. I like fruit. I'm a fruit fan, and a vegetable fan. But guess what? Just because it's a fruit and vegetable doesn't mean that it's healthy for everyone. So those were some of the key things that I took away, and really started looking at. It's not a calorie problem. We're not a nation. Number one, our bodies don't have calorie receptors. We're not a closed loop system. If it were only that simple, but it's a hormone problem. And if we can learn which foods elicit which hormonal responses, we're not going to have to use willpower and grit to fight off hunger or to restrict that. I mean, how many of us, and I laugh because I can remember so many times, that we pack up half of our to-go box because it's the right thing to do, or we've eaten enough, only to eat it right when we get in the car because we're still hungry. And we're still hungry because we've shot our insulin through the roof by chowing down on the chip basket or the bread bowl before our food ever came, continuing to eat all that food that's loaded in seed oils and sugar that keeps us hungry. And then I don't care how full we are, we can plow down some dessert at the end. And you get in the car and you're like, how am I still hungry? There's no way that should be possible. But when you spike insulin and you keep it high and our cells are resistant and we can't get that energy into them, of course you're going to be hungry. And it's a cycle that continues.
So after reading that book by Lily Nichols, do you remember the name of the title of the book by any chance? If not,
Real Food for Pregnancy.
okay. So we will put the link in the notes. But after you read that book, how long was it before the way that you interacted with patients changed, and
Oh,
what were some of the results?
well, first off, I anything I'm going to talk about, I'm going to walk it. So I immediately was like, okay, I'm going to start intermittent fasting, and I'm going to go keto. And prior to that, I had thought, ooh, I don't know if keto is such a good idea. All of that saturated fat cannot be healthy because that LDL is going to go up, right? Cutting out food groups. We don't need to cut out food groups, Chris. Like that's what was in my head. And I can remember having conversations. There was a nurse at one of my dialysis clinics and she came in, she was like down a lot of weight. And I'm like, what have you been doing? She was like, well, I'm on the keto diet. And I was like, no, you can't do that. It's not good for you. And so the first thing that I did was adopted a ketogenic diet and started intermittent fasting. And I was blown away by how I felt, by my blood work. And I started absorbing everything like a sponge. Dr. Ben Bickman's book called Why We Get Sick was one of the first books to read. And I don't know, it's just, I feel like I am like a crazy person because I can't get enough of it. And now that I know it and see it and have been able to implement this with my clients or patients, and the results that they're getting it's mind blowing. I'm like, how does everybody not get this? How does everybody not understand? But when you get messages and my phone blows up all day from people that I've never met that see my social media and say, I started doing what you made videos on or what you talked about. I'm off all these medicines. My blood pressure is controlled for the first time ever in my life. I've lost 86 pounds and my A1C, it went from 16.5 to 5. Thank you for saving my life. That's all the justification I ever need.
Oh, that's powerful. And yeah, it's kind of amazing. What do you think the barrier is to getting this message through to more people, and at least getting therapeutic carbohydrate reduction and these therapies to be accepted as an option? I mean, even if they're not the prevalent option, so many people are discouraged outright from even trying a diet that can literally turn their life around. What do you think the reason is for that?
Um, I don't believe that any physician that's against what we talk about does not have their patient's best interest in mind. I truly believe that they do. But what I also believe is people are so busy. I mean, I worked in pharmaceuticals for 5 years. I can see how busy they are. And there's not a lot of opportunity to learn new material. So they're still just taking the path that they were taught in school. Look, no one proactively taught it to me. I had to go dig and learn it myself. So number one, you have to have an impetus to go outside of the norm, to be different. And then you got to be brave enough to continue to be different when everything around you is saying you're a loony, you're loon, and that's not right. And you're teaching the wrong thing. But it's driven, and you and I think everybody even knows this, it's driven by big food and big pharma. I mean, even the American Dietetics Association is funded by, like Nestle and Abbott, and the American Diabetes Association, Eli Lilly. Like when you have big pocketbooks just supporting you and donating, to go against them, even if you want to. I mean, I talk to clinicians that say, Shannon, the last thing I want to do is put somebody on a statin, but I have to. I've even talked to pharmacists that say, hey, for somebody with type 2 diabetes and hypertension, we have to fill this statin. We have to. Like, so these mandates or these standard of care models have to change, Chris. And until they change, you're going to see physicians pull away from their practices and if they want to do differently, because they can't. They feel tied down. So then, people like me, I can speak as loud as I want to, and I will speak as loud as I want to. There are hundreds and hundreds of studies done on a ketogenic diet with clinical data and proof that not only for metabolic health, but for mental health. I mean, the evidence is there if people will be open to reading it and learning it and accepting it. And Chris, it's been there for hundreds of years. I mean, you can go back to I just was reading it. White, sick, and deadly. What's his name?
Is that Yudkin?
Yudkin, yes.
Yeah.
Back then, and he got shunned, but because that sugar industry is a big, powerful, the American Heart Association, the sugar industry, the American Diabetes Association, they got a lot of power into hushing other practices that work, hushing us up.
You mentioned the American Diabetes Association. I do want to definitely get into your role in the new American Diabetes Society. But before we go there, I want to ask you a little bit. I know you do coaching, right? With a rather large roster of clients. How many clients do you work with at a given time, like in a given month?
Between my own personal business and ONA, I would say well over 200.
And of those clients, what are some of the metabolic diseases that are most common for you to be working with?
Yeah. Type 2 diabetes is probably number one. Obesity, PCOS, fatty liver, hypertension, you name it.
And of those diseases that you work with on an everyday basis, how many of those diseases are, in your opinion, reversible?
All of them.
So that's also very powerful. And so with the knowledge that you have and the skills that you have as a health coach and as a registered dietitian, and like your expertise that you've acquired over the years, both working within the system as it existed and now doing this it's actually becoming more and more accepted, fortunately, but we still have a long way to go. I would like to know, like, what it's done for you in your career and how you feel about the work you're doing and what kind of results are you seeing?
Correct. Well, first off, I was able to walk away from corporate America last June, actually June 14th, to work my own virtual metabolic health business. It's been the most fulfilling thing that I have ever done in my life. And I don't want to cry because I get emotional about it, but I know without a doubt that I am fulfilling my godly purpose. And it is to truly help people save their own life. That's how I look at it, is I am just the messenger. You are the ones doing all of the work. But if you don't have the right information and the right path to get there, then you stay stuck, or you think that you're a failure. And so I just try to empower people by giving them the right information, being their cheerleader. I am not a drill sergeant. I will hug you and love you and cheer you on, and we will do this together. But I have hundreds and hundreds of testimonies from people I know, and then just as many from people that I've never met a day in my life. And every day that I get one, it reassures me that I am doing what I am supposed to be doing. And despite mainstream media, despite standards of care, people are living healthy lives. I got a message last week from a guy who said, I'm 65 years old. For the last 15 years, I was told I had severe rheumatoid arthritis. I was on pain meds, and every day was misery. Because I watched a video that you made on the side effects of statins, the last 3 weeks have been the best 3 weeks of my life. Thank you.
And can your fans find those videos on your YouTube channel, or is it on Instagram?
I need to start a YouTube channel, but I have my Facebook is probably my biggest platform. I had a TikTok account, and I mean, I'll chuckle about it now, but TikTok shut it down. I worked 2.5 years to build that up with over 70,000 followers, over 2,000 videos, and it zilched that one in the second. But it's okay because they're not going to win. But my videos are some are on LinkedIn, most are on Facebook. There's a good bit on Instagram.
Okay, and people can find all of your links on the link that's on the screen, Linktree/Shannon Davis. I know you've got an X account that's growing. I know that you've got a big Facebook account, and you're on Instagram and LinkedIn. So lots of great stuff there. I know you are very active on social media and very good at it. So tell me a little bit about the American Diabetes Society, and you're on the board, correct?
Correct.
So how has that been received by various people, and what is your goal and your mission with that? And tell us a little bit about how the American Diabetes Society came to be and how that you got to be a part of it.
Awesome. Well, I think the reception has been amazing. We are slowly trying to get out there. We are accepting donations from non-pharma, non-big food only. We are very transparent. All of our board meetings are public, so people can go watch them. But I got to be a part of that due to one of my best friends, Michelle Hearn, who she's a dietitian. She got to choose a couple dietitians to join her. So it's Temple Stewart, Shauna Hussein, Michelle Hearn, myself, we're the dietitians. And then Dr. Ken Berry is heading it on, Dr. Ben Bickman, Dr. Mariella Glant, the endocrinologist I work with, Dr. Tony Hampton, Dr. Eric Westman. And so our mission is to not just manage, but reverse type 2 diabetes through a low-carb, ketogenic, intermittent fasting lifestyle. We've got meal plans. We've got recipes. We want to empower individuals that you can reverse your type 2 diabetes, that you do not have to live with a chronic and progressive disease. If you follow the standard of care, it does become chronic and progressive. But we can provide you with the tools that you need, the support, to come find good information. Really, we just want to be the place, the go-to, Chris, where people feel confident and safe, knowing if I go to the American Diabetes Society, I'm going to find, clinically backed evidence and that will get me well. These are recipes that are healthy for me, not unlike the American Diabetes Association, where it has like eat oatmeal with brown sugar, fruit, granola, and a glass of orange juice. You will not see that here. You will see, we even have vegetarian options because we know there are vegetarians out there that also struggle with type 2 diabetes. So we're going to be having fundraisers. We're going to open it up for volunteers. I think we're going to try to have t-shirts and have events and be present at some of these, conferences. We just truly want to become the go-to resource for anyone with type 2 diabetes.
All great stuff. You mentioned some amazing people on that list. Many of those people I've got to see present live and in person at many of the Low Carb USA Symposium for Metabolic Health events, including Michelle, who I've seen present, and I've had the opportunity to interview Dr. Tony Hampton, Dr. Ken Berry, Dr. Eric Westman. All of these people are making a huge difference on so many fronts. And I would urge anybody that's interested in attending one of those symposiums. There's one coming up in August in San Diego, the 10th annual San Diego Symposium for Metabolic Health. And you can find out more at lowcarbusa.org. And I know that you can save 20% if you use code IFIXHEARTS. So that's just a little, you're working with some great people there. And let's see, I wanted to Man, there's so many different angles to go. Um, I, Tell me a little bit about the work that you've done with organ transplants.
Yeah.
How did you get involved in that? And the reason that's intriguing to me is because, unfortunately, a lot of people that end up getting type 2 diabetes, they're one group of people that ends up with failing organs. And then I want to circle back to what some of the common problems are for type 2 diabetes and why so many of them struggle so much. And I'll throw in one little bit of added context, and that's that I have a 51-year-old brother who he's a type 2 diabetes patient, and he has been for like 20 years. But unfortunately now he's on the kidney transplant list. He gets dialysis 3 days a week. So it's a personal issue for me and my family. But unfortunately, I'm not unique in that situation.
Oh,
So many Americans either are affected by type 2 diabetes, or they know someone very close and personal whose life is being greatly diminished or destroyed by this disease. And as you mentioned before, it's reversible until it gets to a certain
right.
state, and then it's not. So tell me a little bit about the organ transplant, and then I want to talk more about type 2 diabetes patients.
Sure. That was a long time ago. That was 2009, no, 2007 through 2010. So a long time ago. So I'm hoping things have changed because we did liver, kidney, and pancreas at the time. And most of our liver transplants were from non-alcoholic fatty liver disease. And at that time, there was zero discussion about sugar, carbohydrates, ultra processed foods, and seed oils. It was about cut the fat out, no fried foods, very lean, no fatty meats, right? So that was a discussion we never had. With the kidney and pancreas transplant, we even coming off with a new kidney, we never once discussed a low carbohydrate diet, never once talked about keto, seed oils, ultra processed food, not one time ever. It was basically, you know, how do we adjust medication around these problems? And then, prior to transplant, it was carbohydrate counting, right? We'll just every, 45 to 60 grams per meal, 3 times a day. If you want to snack at 15 grams, we want to prevent you from going low. You need a snack at night. Our kidney patients, to this day, our kidney patients are still given Nepro or Nova Source Renal, which is basically, seed oils and high fructose corn syrup as a supplement to boost up their albumin or protein. It's just trash. I mean, it, and the two main causes of somebody with complete kidney failure in stage is type 2 diabetes and hypertension. Those are two diseases of insulin resistance. So if we can target the insulin resistance, then we can stop people from ending up on dialysis. And that's the problem. We are being reactive and not proactive. We need to be getting these people upstream, not downstream.
Absolutely. I couldn't agree with you more. Incidentally, about a month or so ago, I had the opportunity to interview Suzanne Schneider,
Mhm.
who was a type 1 diabetes patient for most of her life until she was fortunate enough to get a double transplant. And she remarked that the nutrition information that she was given after receiving this life-changing transplant, pancreas and kidney, I believe, the information she received was almost non-existent.
Yeah.
Like it was just, there you go.
Yeah.
And she was fortunate enough to have a researcher's mind, and she figured out what she needed to do to protect that gift of life that she received. So that interview is available on the iFix Hearts YouTube channel. So I'm very interested to hear,
Mhm.
like, what are some of the biggest obstacles that your clients or patients face who have type 2 diabetes and or some of these other diseases, but type 2 diabetes in particular, and how do you help them um, get to that point where they have hope for reversing the condition and not just simply managing it with band-aid type patches on this condition, like actually live a full and fulfilling healthy life?
Right. I mean, I personally think the biggest challenge we face is carbohydrate addiction. I think that as a nation, we are so, and myself, I am not, you know, absent from this, but I, we're so addicted to these foods, and it's not our fault. I mean, the foods are created for us to be addicted to them. But when I talk to somebody about, like, type 2 diabetes is a disease of carbohydrate toxicity, the and I say, if you're allergic to something or you don't tolerate it, like lactose, do you keep eating it? And everybody's like, no, I don't eat it. If it's toxic or poisonous, or it causes severe distress, GI, do you consume it? No. We need to look at carbohydrates the same way in somebody that has type 2 diabetes. Their body cannot process and metabolize carbohydrates. So the idea to give people more carbs when they're carb toxic and squirt more insulin when their insulin levels are through the roof is crazy to me. And so, but the patients don't understand that because they've been told, I just need to eat and then take this insulin. Or when my blood sugar gets this amount, I take this insulin. The biggest is I need to stay away from salt. I struggle with getting people to not be afraid to have salt and to intermittent fast. My doctor says I can't fast. I can't fast. That's dangerous. Fasting is dangerous for type 2 diabetes. I have to eat carbs. I'm on insulin. I have to eat carbs. So these are some of the big ones. Butter. People are afraid to eat butter, but and eggs. I can't eat those because of the cholesterol. And here's a really big one is my statin makes me feel like trash. I hurt so bad, but I have to take it or I'm going to have a heart attack.
Now,
so that's the problem. The fear mongering that this statin is protecting you from a cardiac event is the most false thing I've ever heard. I mean, the fact that they think that if they don't take it, something's going to happen, when realistically, taking it is only decreasing your risk by 1%. So it's a false sense of security. Prediabetes is a false sense of, I got time to do other things before I'm sick.
Let's see. So many good points. I also know that a lot of diabetes patients who might be struggling with kidney problems are told to basically avoid protein, which, unfortunately, if you tell a patient to avoid protein, what else are they going to start eating?
Right.
It's like, without protein, your desire for carbs is even higher because your satiety levels are so poor. Let's see. We got a couple of comments here. I just want to flash on the screen. Somebody's begging you to start a YouTube channel. So we appreciate you listening. The dog paw or something like that. I got a comment from Pam, who is one of the co-founders of Low Carb USA, and she mentioned Suzanne Schneider, who was at the Type 1 Diabetes Symposium in January of 2024, I believe, and then Pam mentioned another one. She had that's about Suzanne's did a study that was published that has to do with the transplant and the nutrition. So thanks for listening, Pam. Appreciate it. And okay. One more. We really appreciate you guys listening and commenting. An Ovadia patient. We really appreciate you, and thanks for listening. Thanks for commenting. Anybody that's on YouTube or LinkedIn can drop a comment. I'll try to scan the any comments that come up elsewhere, and if I find them, I'll throw them on the screen. But let's see, where do we want to go from here? I think if there's anything you want to continue with, be my guest. But I also want to talk to you a little bit about GLP-1s.
Okay.
that's a hot topic these days, and I'm sure you'll agree that GLP-1s are going to solve all of our problems, right?
Oh, of course, of course. Um,
What are your thoughts? What are the possible benefits, and what are the concerns that you might have?
um, First off, I want to respect anybody that uses these medications. It is, as long as you've been thoroughly educated about the pros and the cons. I don't know that every person that gets on these medications has had the thorough education that they need to know the things that could happen. And everyone thinks that it's not going to happen until it does. Okay. So that's first. Second is I am not anti-med. There is a time and place for medications. But I think that I think these medications are being highly abused. I think that people that want to lose a little bit of weight or may not want to exercise or may not want to give up the foods that they enjoy and just think that I can just inject myself and be done with it. But we're setting ourselves up for bad things to come, I believe. I think that we're going to see lots of things happen in the future. I can't tell you exactly what they are, but it just doesn't sit well with me. Anytime we play with Mother Nature, there is going to be a consequence. And look, I understand when people have tried everything, Chris, to lose weight. They've tried everything, and now there is something. I can see the draw to that, but I want people to understand it's not the only way, right? If you can implement, I teach my clients a 3-step protocol. We incorporate intermittent fasting, 12 to 16 hours to get started, a low carbohydrate diet. And then I use some natural supplements to help people break up with carbs and to shut the food noise off, because this right here, it's a mate concentrate. It upregulates our own production of GLP-1 by 60 to 70%. So you get the benefits. Your food noise shuts off. Your appetite is suppressed. Fasting's easier. Your cells become more insulin sensitive. And if we can flip that switch and teach you to be metabolically flexible, your appetite is going to be controlled, because guess what? You get energy 2 ways, through food and through your own reserves. But if insulin's high, you'll never get it from your reserves. So if we can get your insulin down, your hunger is going to go way down. Why? Because your body's pulling energy from itself. So the GLP-1s, I believe people get on them because they want to lose weight. And then here's what happens. People are terrified to come off. They don't know how to come off because they don't have a what's next. I want you to come to me. I want to help you. I want to show you what there is a what's next. We can teach you how to you don't have to rely on a medication to keep your appetite controlled, because we know after 24 months, most people stop them themselves because of how terrible they feel. 3/4 of the weight loss comes back, and it is not muscle. 40% of the weight loss is muscle and bone. You're at risk for pancreatitis, guys. Pancreatitis is one of the most painful conditions that one can have, and it can cause pancreatic cancer and death. It's not a joke. Permanent gut paralysis. We're talking about feeding tubes. Thyroid cancer. Yes, it happens. And then the muscle and bone loss. Now we're seeing optic nerve damage. Men are having erectile dysfunction. And then the fact that we're going to start our children on these to become lifetime patients is absurd, because you're messing with ghrelin, which is messing with growth hormone. You're messing with ghrelin, which is messing with autophagy. If you don't get autophagy, you're not going to get proper cell turnover. You're going to increase your risk for things like cancer. I just think we're playing in muddy water when we don't have to. That's the thing, is there are other options.
Well, personally, I think that one of the problems we run into in the healthcare space is when we resort to drugs as the reflexive solution.
Correct.
It actually, even if it is a good drug in specific cases, we oftentimes use it instead of sound lifestyle decisions that could be incorporated. But because you give a drug, the lifestyle is overlooked. And personally, I think that patients should be given the urgency that those lifestyle changes are important, and that they are, like, not just important, but that their lives depend on it. Like
Mhm.
figuring out how to eat the right foods, figuring out how to incorporate healthy movement, activity, resistance training into your life, figuring out how to do these things isn't optional. Like if you're
Correct.
60 or 70 years old, and your muscle is diminishing, and there's a lot of ways. Like I'm 60, almost 61, and if I'm not actively trying to build and maintain my muscle, it's going to disappear.
Mhm.
And it doesn't bode well for somebody who doesn't have adequate muscle when they fall and they break their hip, they can't get up, they can't support their weight on a handrail.
Mhm.
There's so many aspects that have to be taken seriously. So that's really my take. I don't. Um, I agree with you that um, drugs have a specific time and place, and of course, you've got to weigh. There's always going to be potential for side effects,
Mhm.
and if you just and some people are taking. I mean, how many drugs are some of the people that you work with taking? I mean, I've seen lists where
19, actually, there was a guy who was on 25 medications.
so the interactions between drugs, you're taking drugs to alleviate the side effects of other drugs, and pretty soon it's hard to even tell what's doing what in some cases, and then you some of the side effects are counteracting things that we really need to be productive, healthy, have a good quality of life.
And
So
here's something, Chris, too, that I forgot to mention. So why are we taking these drugs? I would think that most people are taking them to become metabolically healthy. And now most people are going to say weight loss, but that's part of becoming metabolically healthy. So let's just think about this for a minute. If let's say you're on these drugs for a year or 2 years and you've lost significant amount of weight, well, 40% of that is muscle. Okay. Muscle and bone. Muscle, 80% of the glucose uptake in our body is through our muscle. So now we're off the drugs and we're metabolically healthy. But wait, our biggest glucose sink, we're 40% missing 40% of that, right? So our glucose is potentially going to bounce back higher. These drugs increase insulin production, and they block glucagon. Well, we've seen in some of our patients that have been off these drugs, now we're seeing hypoglycemic events happen. We don't know why, but they're consistently happening. That's not good. So you wonder, is there some permanent suppression of glucagon? Not to mention, have we permanently suppressed our own body's production of GLP-1 because we've been giving super optimal doses of this synthetic? So all of these things are something that we need to be thinking about, not just thinking about the weight loss. We need to be thinking about, okay, what happens when we come off? Are we at a place that we know how to eat for metabolic health? We know how to keep our muscles strong, right? And we don't want to end up back with the weight gain, which we've seen in the studies, 3/4 of the weight gain comes back, but now that weight gain's fat, right? I mean, muscle is a very expensive piece of real estate, and as we age, it is very, very hard to come by.
I want to get your thoughts on some of the aspects related to exercise activity. I know that you're heavily involved in CrossFit and that you're personally active. Before I do that, I wanted to share a comment
Oh,
from Suzanne, who we were talking about just a few minutes ago. Thank you for listening, Suzanne, and thanks
thank
for
you.
your comment. We also got a comment from
Oh,
Michelle.
Michelle.
Thank you, Michelle, for listening and for commenting. We greatly appreciate that. And Michelle is the one who introduced me to
Yeah.
Shannon in the first place. Very, very grateful that she did. So at Ovadia Heart Health, we have a we have patients ranging in age from, early 20s
Mhm.
to 80 plus. And largely it's a lot of people that are concerned about their cardiovascular health, but their metabolic health, trying to incorporate lifestyle into their lives to, you know, be able to enjoy their later years in many cases, to be more productive, to have a better quality of life. Talk to me a little bit about some of the activity related things that you've learned, and what kind of advice would you give to somebody who, 40s, 50s and beyond, who maybe let themselves go a little more than they should have. They don't have as much muscle as they should, and they're not doing much with respect to cardiovascular conditioning. Where would be some of the places people could start?
Sure. Well, again, along with my views on nutrition, my views on exercise have vastly changed as well. I mean, any of us can walk into a gym right now, and what are we going to see? The majority of the people on the cardio equipment just plugging away, and most of them are there when I get there, sweating their tails off, and they're still doing it when I leave. I head to the weight section, and and I mean this in all due respectfully to anyone, but they look the same. They've been plowing away for hours every day. And I've seen you for 3 or 4 years and you ain't changed. But if you go to the weight side, I think maybe weights are intimidating, but anybody can lift weights. If you don't have weights, you can do air squats, you can do push ups, you can do dips in your chair, you can pick up canned goods or milk cartons, and just do curls. You can move your muscles. Standing up and sitting down, standing up and sitting down. Um, you want to work on muscles. Muscle is the key to longevity. Muscle is going to keep you strong. It's going to help with your balance. As far as heart health goes, yes, it's important, but the majority of your time should be on resistance training and building muscle. And then go walk. I think we highly underestimate walking, but here's what walking does. It allows you to clear your mind. If you can go somewhere different, you can let the sun hit your eyeballs. You can hear nature. So you're getting some nature, some detoxing from phones, from all of the social media. You take your dog, how much your dog will appreciate that. My dog goes crazy. I walk him every morning and every evening, no matter what, because it holds me accountable. So I think if we can just move, it doesn't have to be a gym. It doesn't have to be CrossFit. It doesn't have to be Orange Theory. But if you can say, I'm going to move, and it's not to move to lose weight. It's not to move to punish yourself or to burn off the food that you ate. It's to move so that you can move for the rest of your life, so that you can pick up your grandchildren, so that you can bend over and tie your shoe, so that you can wipe your butt. I mean, let's just face it. So that if you fall, you know how to get up, or you know how to land.
Yep.
And I mean, I slipped and fell down the stairs the other day, and I literally thought I was going to die. But I mean, thank goodness I had some cushion to land on. And it's because I've lifted weights. I've done some squats, right? So I think that people are there's a negative connotation to exercise because they think of it as torture or punishment. And you got to do hours and hours. It does not take that. It just simply takes getting started. And that can be a 20-minute walk in your neighborhood. Or, like I said, getting some resistance bands. Push-ups are free. Air squats are free. Sit-ups are free. And you got plenty of stuff in your house to pick up and lift above your head, or curl in your arm curls. So
You make some excellent points, and these are things that in my work as a health coach at Ovadia Heart Health, um, uh, I talk to patients about trying to figure out ways to sometimes kill two birds with one stone. Like you mentioned, you go for a walk. If you go for a walk, you can either meditate on your own, you can appreciate nature. You could go with a spouse or a friend or a sibling or a child or whatever, and you could get some socialization, which is healthy and productive. If you do it with either by yourself or with someone else, it can be very de-stressing. It helps you unwind, clear your head. I know personally, I go for a lot of walks or runs with my wife and my daughter, and when it could be the most stressful day, and when you get back from a run or a walk, it's like just everything is clear, at least for me. And that should be the objective. Is what I also appreciate what you said is about the exercise should not be a punishment. And the same is true about your diet.
Yeah.
Both are true. Like, we need to figure out ways to get a formula that's enjoyable and sustainable. This can't be about, I'm going to do this until June 20th when I lose 15 pounds and then it's over, because then you're right back where you started. So finding a way to make this sustainable involves, figuring out weights, activities that you enjoy. And I liked your suggestions. I mean, I think a lot of people that I talk to have it in their head that resistance training is more of a commitment than it really is. Like you said, with air squats and push-ups, I mean, you could make some serious beginner's headway by just incorporating a few basic exercises 2 or 3 times a week for 15 or 20 minutes. And if you did it consistently with a reasonable amount of intensity, you could definitely make some serious progress. Now, you're pretty serious about the CrossFit, are you not?
I love it.
What level are you doing? Are you competing?
No. Oh, no. I wish I would have started it earlier in life, but I didn't. I've lifted weights for most of my life, but I didn't start CrossFit until 2020. And, it's a funny story. I tell everybody, I'm like, I thought I was going to go in there and just like, I got this, because I've been lifting weights my whole life. And was I humbled to my knees? Like, I can't even tell you, like, I didn't know how to do double unders. I didn't know how to do, proper pull-ups. I certainly couldn't snatch a weight over my head or do cleans. Now, and I've learned how to do all of that. Now, is it great? No, but it's good. It keeps me, I'm becoming functionally fit. That is what I want to do. I want to be able to move and be flexible and do it properly and not hurt. And I want to be able to do it for the rest of my life. And so that is truly my goal. And I'm having fun with it. I mean, it's humbling and it's challenging to suck at something. But it kind of like my, competitive personality. I'm like, I can't be the worst person in the room. I'm already the oldest one in the room, but I'll be darned if you're going to beat me, So
How old are you, Shannon?
I'll be 45 next week.
Okay. I got you by 16 years. And I know what it's like to be the oldest person in the room. I think it's important that no matter where a person is at this, there's always going to be someone better. And and maybe a lot of people better. And there's always going to be someone that's struggling more than you. It's important that we all, once we are aware of that, it takes off a little bit of the pressure. You're not going to be the best when you first start out at this. I've been humbled a lot on, I've met a lot of people on social media. I ended up started running a 5K about 5 or 6 years ago, and then a faster 5K. And then some of the people that I follow on X started encouraging me to run a half marathon. And sure enough, my wife and I ran a half marathon. And then that led to our first and so far only full marathon at the age of 58, I believe it was. So, but like, you go and run a marathon, there's thousands of people that finish ahead of you. And there's people that are older than me who finished ahead of me. There are people that are more overweight than I was who finished ahead of me. But so it's humbling, but it's also, just spectacular that you can train your body to do something that you never dreamed possible.
Yeah.
So,
and don't compare. Either compare with yourself and
exactly
push yourself. But when you start comparing, you're gonna pull all joy and away from it, and it's going to not be fun, and you're going to feel like a failure. and you're going to quit. But if you can say, you know what, I got my blinders on, I am focused on me and being better than I was. You know what? My snatches still look like trash, but they're better than they were in 2020. So,
You are right. And you're right also that comparison is indeed the thief of joy. Um, so, I mean, this has been a tremendous conversation. Is there anything else that you'd like to bring up or address? Do you have, I'm curious about your level of optimism or pessimism, possibly, with where we are in this metabolic health challenge that we're faced with as a nation. Do you think that we're going to, as a society, going to take some of the things we've learned and make things better? There's been some shifts in politics for sure, which I don't really want to go into politics, but I do want to get your outlook for where we're headed with metabolic health.
I am very optimistic. It's going to take some time, but we've got it started. That ball is rolling, and it takes all of us. I know I'm just an individual. Chris is just an individual, Dr. Ovadia, but if all of us join together, we're way strong. We have an army of people that want nothing more than for people to be healthy and for people to be empowered. We need to ask questions. We need to challenge the status quo, and we need to fight for what we believe in. Am I going to make a difference? I don't know. But that person who I helped, I made all the difference in their world. So if I can change one person's life, then I've saved their world, and that matters to me. And so I am very optimistic. I think the Make America Healthy Again is a great start. It's going to take some time because we're up against some major Goliaths, but David did it. If David can beat Goliath, why can't we? And so I just think that we have to not give up, and we've got to work together. And despite whatever political affiliation you belong to, I think we all want the best for human nature and for our children and for our families. And that means getting rid of crap food. That means getting rid of seed oils. That means changing the dietary guidelines. That means putting big food and big pharma in their place. We're never going to get rid of it, but if we change it, I don't have the answer. I wish I did, but I think we're on the right path, and I think we have some really smart people by our side, and I think we just got to keep going.
And one thing that I, have heard, I know Dr. Ovadia has referenced this many times, is regardless of what happens specifically with our mainstream system, we certainly, there's some reason for optimism. Individuals still have the power to make choices and take control of their personal responsibilities, especially if they work, either working with a health coach or a practice, or even, you can find people like you, Shannon, on social media, and it's free to watch Shannon's videos. It's free to learn from all the free content that she posts, and it's also, you can go to the iFix Hearts YouTube channel and watch 100. We're getting close to Dr. Ovadia's 200th episode of the Stay Off My Operating Table podcast. So these are all resources that you can access, or you can buy, books like the one that Shannon has mentioned, or Dr. Ovadia's book, Stay Off My Operating Table, for the price of, $20 or something. You can get a book that could change your life. I want to put, once again, Shannon, your links. There's a long list of links right there at linktree.com or linktree/Shannon Davis. It's on the screen, and I will put it in the notes after we get this all taken care of on YouTube, where people can watch this again later. And I also want to let people know that if you want to schedule a call with our metabolic health consultant, you can go to ifixhearts.com/talk and learn how you can become part of the Ovadia Heart Health team, work directly with Dr. Ovadia, work with our nurse practitioner, Lisa Simmons, and our team of professional health coaches. So with that, Shannon, is there anything else you'd like to leave before we say goodbye to our nearly 900 people that are listening live? And, I know there's going to be probably thousands more that end up watching this on YouTube, or the recorded live stream is going to be available on X as well.
I'm so grateful to be here, to be able to get in front of an audience of people that truly want to change their life. And I just encourage everybody, you can do it. You should ask questions. And, you know, chronic metabolic disease is reversible. So don't let people tell you it's not. It ain't easy, but it's doable and it's simple. So easy and simple are different, but you got people here that'll help you. You've got people that'll cheer you on, that'll do it with you, that'll hold you accountable, that be here to answer questions. And so I just encourage you, if you are stuck and you're ready for change, look, it's there. There's so much out there. And, you know, I am always happy to answer questions and to help people. That is what God put me on this earth to do. And so thank you.
Well, thank you very much, Shannon. I really enjoyed the conversation and I learned a lot. And I know that our listeners have also learned a lot. And thanks everybody for joining the live stream. We have an Ovadia Heart Health Employee Wellness live stream with Dr. Phil Maffetone, who's going to join host Krishna Hanks, our Employee Wellness Director. That's Monday at 5:30 p.m. Eastern Time. I encourage you guys to listen to that. And not sure the exact date of our next telemedicine live stream, but we usually do them once a week. So thanks everybody for joining and hope you have a great evening. Take care.